My name is Rachel. I'll be your nurse today. Can you tell me your name and age?
Brittany, age 29.
Okay, Brittany, I'm going to be doing your head-to-toe assessment today. I'm going to start off by asking some simple questions. I'm going to be doing a lot of touching and listening over different areas of the body. It doesn't mean anything is wrong. It's just all part of the assessment. At any time, if you have any questions, concerns, you feel any tenderness, pain, or discomfort, feel free to stop me. Is English your natural language?
Yes, ma'am.
Can you tell me who the president is?
Donald Trump.
Of your mood, are you usually a happy person?
Yes, ma'am.
Okay. Do you have access to 3 meals a day?
Yes.
Your body mass index is equal to your height and weight, which is a very good thing. Your posture is nice and straight. Your hygiene looks like you have real good hygiene. You're nice and clean. Can you stand for me? Okay. Can you sit back down? I noticed when you walked in the exam room, your gait was nice and good, and your balance was good. You didn't use any assistive devices. Do you use anything like a crutch, a cane, walker, or wheelchair?
No, ma'am.
Okay, that's perfect. I'm gonna start with your head assessment.
Okay.
Report on a 29-year-old female patient in for a head-to-toe assessment. Patient started out by stating her age, which was 29. Alert and oriented ×3. Great nutritional status noted with access to 3 meals a day. Her body mass index was equal to her height and weight. Her gait and balance were good upon ambulating without the use of assistive devices. Patient states she has no deformities or abnormalities with none noted. Her speech was clear, coherent, and answered questions appropriately, with English being her natural language. Her hygiene was good. Patient was nice and clean. Head was without lumps or bumps noted, denies tenderness to palpation. Her scalp was free of lesions, irritations, or bruises. Her hair was blonde in color, clean, and free of infestations or dandruffs. Her face with cranial nerve number 7, her facial, intact, without any weakness or involuntary movements noted. Her face was symmetrical. Her maxillary and frontal sinuses were non-tender. Her temporal arteries were palpable and equal. Her eyelids and eyebrows were symmetrical. Cranial nerve number 1, olfactor number 2, optic number 3, oculomotor number 4, trochlear number 5, trigeminal number 6, abducens number 8, vestibulocochlear number 9, glossopharyngeal number 10, vagus, and number 12, hypoglossal, all intact. Temporal mandibular joints articulate smoothly. Eyes with sclera white, conjunctiva pink, cornea clear, and pupils equal, round, and reactive to light accommodation. Her ears were non-tender with ear canals clear. Patient was able to hear whispered words bilaterally. Her nose was midline with septum midline, nasal mucosa pink, nares were patent. Her lips were without lesions or cracks noted. Her buccal mucosa is pink and moist. Her teeth, her tongue, hard palate and soft palate were all without and tongue were all without exudate noted. Her neck with thyroid glands non-palpable, without tenderness. Her lymph nodes were palpated with no tenderness noted. Her carotid arteries were palpated and auscultated one at a time without thrills or pulsations noted. The lungs were clear to auscultation, both anterior and posteriorly. Her respirations were even and unlabored at a rate of 18 breaths per minute without the use of accessory muscles. Upon auscultating her lungs, there were no adventitious lung sounds heard. She was negative for CVA tenderness, and resonance were heard posteriorly. The heart point of maximal impulse is at the 5th intercostal space and left midclavicular line. Apical pulse was palpated right at the mitral at 80 beats per minute. S1 and S2 were heard. The apical pulse was at a regular rate and rhythm. The abdomen was inspected at an eye level and was flat and symmetrical. No scars, striae, or discoloration was noted. Bowel sounds were present in all 4 quadrants. Negative to palpation, negative for pulsations, and negative to light and deep palpations. Tympany present with palpation in all 4 quadrants. The skin on the patient was warm and dry to touch and appropriate for race. Hand grip was strong bilaterally. Nail beds were pink and clean with capillary refill of less than 2 seconds. Brachial and radial pulse palpable bilaterally. Cranial nerve number 11, spinal accessory, intact with full range of motion against resistance. Bilateral lower extremities symmetrical with good hair distribution and full range of motion against resistance. Skin was warm and dry to touch without edema or varicose veins noted. Peripheral pulses palpated, femoral, popliteal, posterior tibial, and dorsalis pedis bilaterally. Heel to shin intact bilaterally. Patella reflex +1 bilaterally. Negative for scoliosis screen. Spine was midline. Shoulder, scapula, elbow gap, iliac crest, and gluteal folds symmetrical. Romberg's test demonstrated with minimal swaying noted.